Came on. My name is Dr. Dara Rampasad, and I am the proud owner and operator of BluePaz First Responder Services.
Well, first of all, I'm very excited to be here, Dara, and thank you for the invitation. I didn't think I was going to be here, so we made a nice video. And if I don't show the video, the guy I tortured to make this video and have it done this morning is going to be very angry. So I'm going to share that with all of you really quick. That'll give you a great introduction, I think, to what we do here at Lighthouse. And then I'll just take a couple of minutes after that as well.
As a public benefit corporation, the Lighthouse Health and Wellness mission is to ensure that every public safety agency in the nation is able to provide its employees and families with confidential and anonymous access to health and wellness resources. The concept of the Lighthouse Health and Wellness platform was inspired by a need and opportunity first recognized by the 100 Club of Arizona. We collaborated with the 100 Club of Arizona to create Bulletproof and Fireproof, a pair of apps and web portals that deliver these vital resources at no cost to all public safety agencies in Arizona. Lighthouse Health and Wellness provides first responders access to tailored resources anytime, anywhere, and across any internet-connected device. To accomplish our goals, we've developed 3 initiatives: Lighthouse Core, custom agency applications, and continued resource development. Lighthouse Core is the foundation of Lighthouse and provides the essential services we feel all public agencies should have. These include a growing directory of first responder-focused resources, a calendar of wellness events, and most importantly, a section to add resources specific to your agency. This ensures that all programs and resources already provided by your organization are easy for them to use and benefit from. Lighthouse Core is and always will be available at no cost to our nation's public service agencies. Custom Agency Application is built on the robust foundation of Lighthouse Core, but gives us the opportunity to provide more hands-on, proactive, ongoing support to your agency. This includes additional tools, technology resources, and virtually unlimited innovation to provide services specifically tailored to your organization. At Lighthouse, we have the utmost respect for public safety and considered it a privilege to help first responders face the often unthinkable challenges presented in their critical line of work. Because we want to provide these essential resources to as many people as possible, we've created a pricing model for our custom applications that has flexibility and is based on agency size and other variables that makes this technology available to organizations large and small. We believe in an inclusive approach when it comes to providing employees access to vital and even life-saving health and wellness information. That's why Lighthouse Core is and always will be free of charge. Continuing to provide the highest quality resources is essential, so revenue generated from our custom applications and sponsorships is invested back into Lighthouse at the local, state, and national levels. This creates a sustainable system that promotes both accessibility and excellence. Together, we can make a difference in the health of our nation's first responders, who put their lives on the line for others every day. If you're a nonprofit, a healthcare provider, association, or are a public safety vendor that wants to learn how you can support this initiative, we encourage you to reach out today. Through our growing network of agency, corporate, community, and association partners, we know that together we can ensure that we're taking care of those that take care of us.
All right, well, hopefully that gave you guys a good introduction to what we're doing here at Lighthouse. And I'm going to keep it really short and just, again, say thank you to Dr. Dara and thank you to the 100 Club of Arizona. Be happy to share my longer story of where we came, but Dr. Dara was there when the idea of what the 100 Club has done in Arizona with their fireproof and bulletproof projects encouraged, say, why aren't we doing this nationwide? So I'm not going to get too deep into all of that, but what I want to do is say that we've also realized that time is of the essence right now. We launched this on February 28th. This thing called COVID showed up. Now riots, fires, all this. So really time is of the essence to us. And thankfully through the National Center for the Prevention of Community Violence, we were able to receive a grant from Motorola, and we've brought 15 agencies, which brings our total agencies on board now to, I think, 80 almost. We've got 20 that are developing their custom applications, but our grant from Lighthouse allowed us, our grant from Motorola and NCPCV allowed us to provide a scholarship to 15 agencies. And we haven't announced the winners yet, but I will say that, I shouldn't say winners, the awardees, we have a top 3, maybe 4 employee agency in the United States we're onboarding, and we have an agency that has probably not seen a night of rest in the last 100 days that we're working with to bring this tool to them. The response and enthusiasm that we got has led us to kind of change our model a bit, as opposed to charging at all our first year for Lighthouse. And our pricing is very upfront, $2,500 for your own app. If you're under 100 employees, $10 per employee per year. Beyond that, it's optional. Year 2, year 3, year 4. If you can't afford it, we're not going to let you keep your app. But we're expanding our scholarship program. Our first class of 15 should be announced pretty soon. I'm going to paste in here that if you're an agency that wants to look at getting an app for your agency for health and wellness, we'd love for you to apply. Our core program will be free. So I'll be following up with anybody who's interested in the scholarship to talk to you about the free program. It takes about 15 minutes to set your agency up. And with that, thank you all for your service, and we look forward to chatting with as many as you possible and helping continue to do and spread the good work that you all are doing here to the folks that are on the ground and out on the streets and those that support them every day.
Thank you, Joe.
Thanks, sir.
I also want to add a quick plug in here for Joe, because Joe is a real philanthropist. From the get-go, Joe and I have had conversations, and he is mission focused, which is to save lives. It has never been about making money for you, and I've always respected that. It's something that we all do in our own service, just to make sure we work as a team and to make sure that the mission is fulfilled, which is we take care of people and we worry about anything else later on. I think that money is a byproduct of our passion for what we do. And we're very fortunate to have a great team of all of us working together to accomplish this goal. And the great thing about these kinds of conferences, Joe, is that we could roll everybody else into our team, so we expand, these force multipliers to help save lives. So thank you, Joe, for what you do. And I know that you have some comments and questions in the question and answer, as well as in the chat box. So if you can, please feel free to hop in.
Certainly, and I'll be available. I'm going to paste in. Our priority is to get to all 50 states, where we launched in February 28th. There's been some stuff that's happened between here and there, but I think we're already up to 26 states. For our international folks, would love to talk to you as well. Territories, we want to help. So please do reach out. We are given our priority in our next round of scholarships. We haven't announced this yet, so don't share this, but we're opening it up to you guys. So definitely, with what I'm going to paste in and our good friends from NCPCV, apply. We're going to roll out classes of 15 probably every 1 to 2 months at least, but we would love to see you in there. But we do want to get across all 50 states. So if your state is on the list that I'm going to paste in, we really, really want to hear from you, and we'll work our asses off to try and get something out to you, because a big part of what I want to do, and Dar, thank you for the philanthropy side. It's an honor to be able to be in a position to do this. And the more of you I can get, the more I can go to the other people that your agencies and our taxpayer dollars pay a lot of money to give you things and do your jobs. I think they should be contributing to this cause even more than they do. So it's my chicken and the egg, so the more of you I can get involved, the more I can go to the other folks that have companies like me that have built a good life off selling technology and support and tools to you guys, the more I'm going to be able to help bring in to support this mission as well. So once again, thank you all very much. Dr. Dara, amazing. And look forward to chat with a lot of you as you have time.